Hello, and welcome to Effectively Partnering with Rural Communities for Public Health Communications. My name is Cassandra Mohan, and I'm an education and training specialist at the Population Health Innovation Lab, a program of the Public Health Institute. I'm looking forward to guiding you through Lesson 3 today. I'll start with a general overview of the course, and then we'll jump into Lesson 3. This course was developed with support from the Centers for Disease Control and Prevention Office of Rural Health through funding provided under CDC RFA PW 240080. CDC, our planners and content experts, wish to disclose they have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Content will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept financial or in-kind support from any ineligible company for this continuing education activity. The audience for this course is individuals who may not directly work in rural settings but are involved in rural public health and seek to deepen their understanding of collaborating with rural communities to enhance public health communication strategies. Participants may include federal level or state level public health staff developing communication campaigns or policies that impact rural populations, nonprofit program managers supporting rural health initiatives, hospital system outreach coordinators working with rural communities, consultants providing strategic support to rural clinics and health departments, nurses working in rural communities, and others. This course seeks to deepen participants' understanding of how to effectively partner with rural communities to enhance public health communication strategies by building relationships with rural communities, planning, developing, and disseminating tailored public health messaging for rural audiences, and collaborating with community partners throughout the communications process. This course was developed by the Population Health Innovation Lab, a program of the Public Health Institute, with support from the Centers for Disease Control and Prevention Office of Rural Health. What to expect in this course? We hope to deepen learners' understanding of partnering with rural communities to enhance public health communication strategies through a series of lessons featuring a combination of strategies and resources. Here, you'll find tools and approaches you can use to support your public health communication efforts. Real-world examples. Throughout the lessons, we've included scenarios and stories drawn from rural communities to help illustrate various concepts and strategies. Insights gathered from rural health community members and experts. You'll hear directly from those doing the work: rural health community representatives, public health practitioners, rural experts, and others, whose experiences informed the development of this course. We hope to deepen your understanding of what it means to partner with rural communities by sharing their voices throughout the course. These insights were gathered through a series of interviews conducted specifically for this course, and you'll see their perspectives quoted across different lessons. Integrated workbook activities. At the end of each lesson, we'll guide you to the accompanying workbook. These activities are designed to help you reflect, plan, and apply what you're learning in a way that's relevant to your work. Course structure. This course is divided into 4 lessons. Lesson 1, Building Relationships. This lesson lays the foundation by exploring the importance of collaborating with rural communities. Participants will learn why these partnerships matter and how to practice active listening and relationship building to foster trust and more effective communication. Lesson 2, Building an Initial Communications Strategy. This lesson focuses on co-developing a public health communication strategy with rural communities. Learners will walk away understanding the core concepts of strategic communications, how to assess community needs and assets collaboratively, and why rural voices are essential in the planning process. Lesson 3, Developing Messaging. This lesson dives into developing public health messaging that resonates with rural audiences. Participants will learn how to craft linguistically and contextually responsive messages and how to meaningfully involve community members in message development that addresses community health and resilience needs. Lesson 4, Disseminating Messaging. This lesson closes out the course with strategies for dissemination. Participants will identify ways to share public health messages with rural communities, such as ways to build on local leadership and promote informed decision-making, and ultimately contribute to better health outcomes. We recommend that participants complete all 4 lessons in sequence to build a solid, layered understanding of the topic. Each lesson is designed to build on the previous one. However, you're welcome to take as many or as few lessons as you want, in any order. We invite you to do whatever works best for your learning needs. Welcome to Lesson 3. In this session, we will learn about partnering with rural communities to develop public health messaging. Let's review the learning objectives for Lesson 3. By the end of this lesson, you will be able to identify strategies for developing public health messaging for a variety of rural public health audiences, identify strategies to communicate rural public health concepts with context-aware proficiency, identify strategies for seeking input from rural community partners when developing public health messaging, and recognize reasons why partnering with rural community members and organizations is important when developing public health messaging to address needs. Here's our agenda for this lesson. We will start with a quick review of the essential steps of strategic communications. We will then explore 2 examples from the field, highlighting why partnering with rural community members and organizations is important when developing public health messaging to address community health and resilience needs. Then, we will be diving deeper by examining strategies and resources for collaborating with rural community partners to develop and test public health messaging. We will conclude by exploring how the key concepts and lessons from this lesson connect to the activities and tools included in the course workbook, allowing you to apply what you've learned in a practical and actionable way. Before we dive into the core content of this lesson, let's take a moment to pause and reflect on the following prompt. Think about an effective past public health communications initiative you were involved in. What made the public health message meaningful and memorable to that audience? Press pause and take a moment to think through this question. When you're ready to continue, press play and we'll move on to the second prompt. Now, think about a time when a public health message didn't land as intended. What factors might have contributed to that disconnect? How might early and meaningful partnership have made a difference? Press pause and take a moment to think through this question. When you're ready to continue, press play and we'll pick up with Lesson 3. Let's review the essential steps of strategic communications introduced in Lesson 2. The first 3 steps are goal setting, understand the audience, and build a communications strategy. If you missed the earlier course content on steps 1 through 3, we encourage you to go back and check out Lesson 2, building an initial communications strategy. After you have collaborated with community partners to set a goal, understand the audience, and build an initial communication strategy, you are ready for the next phase of communications development. Specifically, you will continue to partner with community members and organizations on Step 4, develop messaging, Step 5, seek input, Step 6, deliver messaging, and Step 7, review, and revise. We will spend this lesson focusing on steps 4 and 5 as we explore developing messaging content and seeking input from rural community partners. In the final lesson, we will explore steps 6 and 7 to wrap up the course. Let's explore an example from the field from the school-based substance use prevention program, Keeping It Real Rural. This case study was published by the Rural Health Information Hub, RHI Hub, and does a great job highlighting the importance of collaborating with rural community members to develop messaging content. You can read the full version on the RHI Hub website. Keeping It Real Rural is a drug and alcohol prevention program for middle school students that is specific to rural context. The communications materials for this program were developed as an adaptation of the original evidence-based Keeping It Real curriculum and were customized for rural middle school students. Keeping It Real Rural prioritized collaborating with community partners, specifically local youth in rural communities, to develop effective and context-aware communication messaging for substance use prevention. This collaborative approach included conducting over 100 semi-structured interviews with 12 to 19-year-old adolescents from rural school districts in Pennsylvania and Ohio, using their perspectives to adapt the original curriculum and revise for messaging to reflect the context of rural settings. The program's motto is "From kids, through kids, to kids." The prevention messages of Keeping It Real Rural reflect aspects of adolescents' actual experiences told by kids themselves. The program's curriculum utilizes a cultural grounding model to incorporate traditional cultural values and practices to promote against substance use. The Keeping It Real Rural program developed 5 new videos for the adapted curriculum. Local high school students from Pennsylvania and Ohio were paired with filmmakers to produce video content based on real-life stories, ensuring the messaging was relevant, engaging, and reflected local context of the target audience. Let's check out this video from the Keeping It Real Rural program, focusing on the student collaboration and student-led video production process.
All right, everybody, quiet on the set. We're gonna get things started, okay? Okay, ready? And action.
Okay, we're gonna start with a wide shot and then we're gonna pan over.
I want the kids to see what high school is really like.
And action.
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 These films are all made by kids. They're written, produced, filmed, edited, acted, all by high school kids.
We still get the message across that you don't have to give in to the peer pressure.
I like how they're having fun before the drugs come.
Yeah.
They're having a blast.
Our goal is to make these scenes as much like real life as possible. And the movies use techniques from Keeping It Real.
And then you girls look down at the pocket.
There now looks like cigarette. Wait.
Yeah.
I want the kids to see that drugs and alcohol do not benefit you in any way, that by showing them this video, they have a toolbox.
We can have you stall, take your helmet off, and then do a over-the-shoulder.
The main idea is that there are strategies to get out of doing drugs. This entire video is about helping kids make the right choices.
Now that we reviewed the first example from Keeping It Real Rural, let's take a moment to pause and reflect. Think about a rural communications initiative you've worked with or are familiar with. How might involving community members improve the relevance and effectiveness of the public health messaging content? press pause and take a moment to think through this question. When you're ready to continue, press play, and we'll pick up with lesson 3. Let's explore another example from the field. COVID-19 vaccine messaging from the Alaska Native Tribal Health Consortium, ANTHC. This project's creation process focused on collaborating with rural community members to develop messaging content. 7 Alaska Native language panels were convened to create informational COVID-19 vaccine materials in their respective languages. The Alaska Native Tribal Health Consortium states, by uplifting Indigenous languages, facts, encouragement, and science through Indigenous knowledge systems, the speakers hope to provide people with trustworthy information needed to make informed decisions. In particular, providing elders and first language speakers with information in their language is crucial to ensuring equitable access. You can check out ANTHC's social media post and read more about this project on the ANTHC website. The Alaska Native language panels for this project were multi-generational, with language learners, elders, teachers, and other language experts. Each panelist contributed their own unique talents, from orthography expertise and technology skills to artistic vision and traditional knowledge, all with the intent of translating important information to be communicated effectively and in a trustworthy manner with care for their communities. A language panel participant shared, "It's important for us to communicate in our languages why the vaccine is important, and to make sure that people have the information to make an informed decision." The Alaska Native Tribal Health Consortium also published a video called Protecting Our People, which provided COVID-19 information in 5 Alaska Native languages. You can watch the full video linked here. Let's take a look at a portion of the video now.
Юмта qaunqlxit tanagal hot an qawateit anile
Nikira ti
Kuchanai Kokarina.
Ilat kutan negotin piramosi.
Ko COVID-19 haksni is ero aba neteli. Tanata rongi aho nelan. Geniso qasahano tol nigari nelan. Hadel qol orgahal usk ko bahaq ohuto na astaqtuh qata begel sitige taqata tanais kut ani.
As we wrap up this second example from the field, let's take a moment to pause and reflect. Consider a rural public health communications initiative you may work on in the future. What unique challenges or opportunities come to mind? How do you think these factors might shape the way you approach public health messaging? And how could earlier or deeper community input help improve future communications initiatives? Press pause and take a moment to think through these questions. When you're ready to continue, press play and we'll pick up with the lesson. Now that we've reviewed examples from the field, let's take a look at some strategies and resources that you can use for developing rural public health messaging. Let's get more specific about what elements should be considered when designing and developing public health communication in partnership with rural community partners. In this how-to guide on message design, Compass explains, message design is the process of connecting insights about the priority audience with key information the audience needs to know in order to make the change the program desires. Well-designed messages are simple, memorable, easily understood, context-aware, and meaningful to the audience. Check out the how-to guide on message design from Compass for more strategies. As you work with community partners on drafting and designing the public health messaging, come back to your initial work on understanding the audience. Keep the public health messaging development process context-aware and grounded in a strong understanding of the needs of the target audience. This will help you better achieve your communication initiative's goals. For more guidance and resources on understanding the audience, check out Lesson 2 of this course. In RHI Hub's Rural Health Promotion and Disease Prevention Toolkit, they explain that effective health communication and social marketing strategies include the following components: use of research-based strategies, understanding of conventional wisdom, concepts, language, and priorities for different cultures and settings, consideration of health literacy, internet access, media exposure and audience, and development of different formats and channels for communications materials. Let's take a look at some research-based strategies to help shape the specific language and organization materials you will develop for a rural public health communications initiative. In the Motivating the Public to Support Public Health Toolkit, published by Phrases, they explain that the most powerful language will create emotional reactions, be familiar and easy to understand, and evoke visual images in the mind. Within this Phrases toolkit, there is also a checklist for using clear language non-experts will understand and remember. In this checklist, Phrases recommends that you use words that are memorable and motivating when communicating with a community audience. Let's take a deeper look at the strategies recommended in the checklist. Active verbs. It is easier for us to understand a sentence if it's describing what someone is doing, rather than describing what something is. Instead of, a multi-sectoral approach is necessary, say, different organizations need to work together. Familiar phrases. Our minds ascribe importance and believability to words and phrases we've heard before. Instead of public health indicators, say, public health report card. Vivid words. Most of our informational processing is visual. If words evoke images of people, places, and things, we're more likely to remember them. Instead of reduce exposure to air pollutants, say, make sure the air we breathe is clean, fresh, and healthy. Repeatable sayings. Try to use phrases that you think your audience would be comfortable using themselves, so they repeat your message to their colleagues, peers, and families. Instead of antimicrobial resistance, say, the disease fights back. As you work to develop public health messaging, remember to use clear language and collaborate with community partners. Daphne Johnson Clark, a public health information officer at the Upper Missouri District Health Unit, offered a story about partnering with rural communities on messaging. An example of something that has worked is us doing a letter from our health officer and sending that letter to our newspapers, to the radio, posting on our social media when we have something that is a big enough concern to do that. So we did it with COVID and now with measles. And that gets good reception, and I think it's because it's that trusted messenger. We make sure that the communication is clear, it is concise, it is written at a level that is understandable, and it gives an action that people can do. The CDC Clear Communication Index is a research-based tool to help you develop and assess the language and formatting of public health communication materials. The index was developed to identify the most important communication characteristics that enhance clarity and aid understanding of public messages and materials, and provide a research-based tool for staff to develop and assess communication products for CDC's audiences, no matter the format or distribution channel. Let's take a look at a before and after of a CDC Healthcare Associated Infections, HAI, fact sheet and consider the improvements made. The images on this slide show the fact sheet before improvements. What do you notice? What would you change? Here is the fact sheet after improvements. Do you see what's different? The new fact sheet has a much higher index score for several reasons, including they developed a main message and emphasized it using a call-out box at the top of the web page. They added an image with a caption to support the main message. They included icons to support the percentages of HAI reductions. They removed complex terms and numbers. They created a box for the calls to action that describes how to use the HAI report. And they cut text that didn't support the main message. You can evaluate your own materials using the scoring system of the CDC Clear Communication Index. You can use the PDF forms or the interactive widget. Both are available on the CDC Clear Communication Index website. You can check out the full Clear Communication user guide here. From our review of examples, available resources, and conversations with rural health partners and communities, one key takeaway has consistently emerged: the need for messaging to be context-aware. But what does that actually mean? Context-aware messaging means ensuring that your messages are relevant, respectful, and responsive to the specific values, experiences, and communication norms of rural communities. This goes beyond simply using plain language and ensuring that materials are delivered at a literacy level appropriate for the audience. Context-aware messaging requires a deeper level of intentionality that involves a number of other key considerations. Here are several important elements to consider for context-aware messaging. Relevance to local realities. Messaging should reflect the circumstances, strengths, and challenges of rural life. This includes acknowledging differences in resources, access, geography, trusted sources of information, and lived experience. Messages that feel disconnected from these realities are likely to be dismissed or misunderstood. Tone and formality. Work with community partners to understand the communication norms of your audience. Messages should be delivered in a way that feels approachable and relatable, rather than overly formal or institutional. Some rural communities may prefer a more informal, conversational tone. Others may respond better to a more formal and respectful style. It's important to listen and adapt accordingly. Respectful messaging. This means going beyond avoiding overtly offensive language. It involves being mindful of language that may unintentionally reflect bias, stereotypes, or exclusionary assumptions. Even well-intended messages can miss the mark if not thoughtfully designed with the audience in mind. Acknowledgement of challenges. Trust is built by recognizing, not ignoring, the challenges that rural communities have faced. Addressing these dynamics openly and with empathy builds credibility and trust. Rural and linguistic adaptation, not just translation. Rather than relying on direct, word-for-word translations, focus on conveying the intended message in a way that aligns with rural norms and expressions. This often means working with community members and translators who understand how to infuse context and meaning into the messaging. Genuine representation. Use images, videos, and other visuals that accurately and positively represent rural individuals and families. Avoid stock images that feel generic or inauthentic. Instead, show people and places that reflect the daily life and strengths of rural communities. The Public Health Communications Collaborative has developed helpful resources on how to develop context-aware messaging. Communications that are context-aware should consider tone and formality and reflect cultural nuances, address historical challenges and barriers, and are ideally created in partnership with members of the target audience. You can check out more strategies on the Public Health Communications Collaborative website. Zachary Ray of Native Spirit Consulting offered the following advice when working with rural communities on public health initiatives. I think an important thing to remember is that you have to be curious. You have to go and learn the impacts of policies on certain populations of people. You have to understand what their social determinants of health are. You have to understand where those gaps are. Visuals are a powerful component of any public health communication strategy for helping to simplify complex information, capture attention, and increase the reach of impact of your public health message. They can take many forms, including advertisements, videos, infographics, photographs, and other media content. Among these, images are one of the most widely used and accessible visual tools. Choosing the right imagery is essential to ensuring your message is both responsive and impactful. The Public Health Communications Collaborative offers guidance on choosing images. Best practices for selecting images include: collaborate with community members and those with experience serving your audience to ensure images are context-aware, responsive, and clear. Use visuals that promote positive, health-supporting behaviors and reflect the identities and experiences of your audience. Ensure accessibility. Provide alt text in English or other relevant languages, and follow Section 508 compliance. Try to include a variety of images depicting different traditions and contexts. Now here's what to avoid. Avoid using traditional or cultural dress unless it's directly relevant. Don't include images that reinforce negative stereotypes or suggest people are to blame for their health outcomes. Steer clear of visuals or fonts that are overly busy or distracting. In short, choose images thoughtfully and with purpose. Let your images be a bridge, not a barrier, to your public health message. Another important consideration when crafting your messaging is to communicate in the language your audience understands. This often means going beyond English and translating your messages into other languages. However, rather than relying solely on direct translation, aim for transcreation. Transcreation is the process of adapting messages across languages in a way that preserves the original intent, meaning, and context, rather than translating word for word. The Public Health Communications Collaborative emphasizes that transcreation is most effective when done in partnership. They also highlight the key differences between translation and transcreation. Translation replaces words from one language with their equivalents in another, focusing on accuracy, but often missing tone or contextual nuance. It usually begins with a source text and is performed by translators, computers, or artificial intelligence. Transcreation adapts the core message, preserving meaning while considering context, tone, and knowledge. It starts with a creative brief and is typically done by writers with background or experience with the target audience, ideally native speakers. Here are a few examples illustrating translation and transcreation of English to Spanish public health messages. In the first example, the transcreation avoids overly formal phrasing. In the second example, the transcreation provides a more conversational tone. And in the third example, transcreation adds clarity. Let's take a moment to pause and reflect on the following prompt. Think of a time when you engaged with a rural community. What communication strategies did you use to deliver public health messaging? How might you adapt your strategies now based on what you've learned in this lesson? Press pause and take a moment to think through these questions. When you're ready to continue, press play, and we'll move on to the second prompt. Now, take a few minutes to consider a public health message you've recently encountered. For example, vaccine promotion, chronic disease prevention, etc. How might that message be redesigned to be more context-aware for a rural audience? Press pause and take a moment to think through this question. When you're ready to continue, press play, and we'll move on to the next part of the lesson. Now let's take a look at some strategies and resources that you can use for testing messaging content and seeking input from community partners. As a reminder, Seek Input is the fifth step in the essential steps of strategic communications, and user testing of the messages you developed should be conducted before you deliver the messaging. In the Plain Language for Public Health Guide, the Public Health Communications Collaborative shares guidance on testing messaging content. They say that testing materials with members of your target audience helps you understand a lot more about how much your materials resonate and if your materials elicit the intended outcome. In particular, user testing helps you understand more about how relevant, useful, and resonant the content is. The Plain Language for Public Health Guide explains that you should seek feedback from people who represent your target audience. The guide recommends considering the following questions to ask during user testing. Readability. Is the content easy to read and understand? Are there words or phrases that are confusing or not detailed enough? How many times did you have to read this message to understand it? Accessibility. How did you access this content? Does this work on different browsers and on desktop and mobile? Is this graphic easy to read and understand? Relevance. Does this relate to you or someone you know? Do you feel like this content was designed to support your lifestyle and health needs? Would you be able to easily relay this message to a friend or family member? Reactions. How does this information make you feel? For example, excited, anxious, scared? What does this information make you want to do? Nothing, share the content, or another action? Several portions of today's Lesson 3 content were adapted from the Powering Change curriculum developed by the Population Health Innovation Lab. You can learn more about this curriculum at the link here. As we wrap up Lesson 3, we are now going to review the related workbook activities so that you can apply these concepts to your own work. You can use this workbook to support current and future rural public health communications initiatives. In the description of this course, we have provided a link to a Microsoft Word version of the workbook that you can copy and edit. You can navigate to various activities in the workbook using the table of contents here. During Lesson 3, we covered steps 4 and 5 of the essential steps of strategic communications. You are now ready to complete the matching workbook activities for develop the messaging content and seek input. Activity 4 focuses on develop the messaging content. Activity 4A, draft messaging content. Here, you will choose and copy one of the communication strategies from Activity 3 that you would like to explore further. Then, work with your rural community partners to draft the rural public health communications messaging content for the chosen strategy. Activity 4B, evaluate and refine draft messaging content. Here, using the CDC Clear Communication Index, evaluate and then refine the content of the draft rural public health communications messaging from Activity 4A. Record your evaluation notes in the box below. Then, refine the rural public health communications messaging content as needed. Activity 5 focuses on seek input. Activity 5, seek input and revise messaging content. Work with your rural community partners to recruit members of the target audience to participate in user testing for the messaging you updated in Activity 4B. Complete the table below based on the user testing feedback and conversations with the target audience about how to improve the Rural Public Health Communications Initiative. Then, revise the Rural Public Health Communication Strategy and messaging content as needed. Let's wrap up Lesson 3 with a brief summary and key takeaways. During this lesson, we reviewed the 7 essential steps of strategic communication. We explored 2 examples from the field to better understand why partnering with and seeking input from rural community members and organizations is important when developing public health messaging. And we took a deep dive into steps 4 and 5 related to developing messaging content and seeking input. References highlighted during the lesson are cited here and on the next slide. In addition to the resources highlighted during the lesson, here are a few more we recommend you explore to help guide your rural public health communications initiatives. Thank you so much for joining us today for Lesson 3. If you have any questions, feel free to reach out to us at the Population Health Innovation Lab.